Hello and welcome back to class. This is Holistic Therapeutics HT400 for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows, and this is lecture number 5, which means that we have reached the 5th and final lecture with respect to introducing all of the techniques that we will do in this program. So, of course, you know the first was aromatherapy, followed by holistic aesthetics. Then we had foot health practice, and now we are going into reflexology. And you will also know that there is much overlap between the anatomy and physiology that you have to learn for foot health practice. You need to know the same things when it comes to being a foot health practitioner who uses holistic techniques such as reflexology. So I'm very excited about this lecture, and let's get started. So in terms of Lecture 5 objectives, at the end of today's lecture, students will understand what reflexology is and how it differs from foot massage, be familiar with the history of reflexology, understand how reflexology is applied holistically, be familiar with the aims of reflexology, be familiar with contraindications of providing reflexology treatment, be familiar with the benefits and effects of reflexology, also be familiar with the zone system of reflexology, be familiar with the cross-reference reflex concept, understand how the feet mirror the body, be familiar with the foot, hand, and ear reflexology charts, and be familiar with the educational and training requirements necessary to become a reflexology practitioner, also referred to as a reflexologist. In terms of the everyday practical explanation or definition for reflexology, it is defined as a gentle, non-invasive therapy that encourages the body to balance and heal itself. It involves applying thumb, finger, or tool pressure on the feet primarily. However, the hands and parts of the auricle of the ear can also be used. These points are called reflexes, and they reflect or mirror the organs and structures of the body as well as the person's emotional health. The feet and hands are mini maps or microcosms of the body part that can be used to encourage holistic healing. Foot massage, on the other hand, is defined as the systematic and scientific manipulation of the soft tissues of the entire body. Stroking restores metabolic imbalance within the soft tissue. Massage works through the musculature. Now, because of the use of reflexology becoming more widespread, especially in Western cultures, there may be a more clinical definition that you may see being used, and sometimes practitioners use this definition when they are discussing what it is that they do with persons of the conventional healthcare industry, such as physicians and other therapists, allied health professionals, that kind of thing. And the clinical definition is that reflexology, an integrative health practice, maps a reflection of the body predominantly on the feet, hands, and outer ears. It uses unique manual techniques to deliver pressure to neural pathways, assisting the body to function optimally. The effectiveness of reflexology is recognized worldwide by various national health institutions and the public at large as a distinct complementary practice within the holistic health field. Reflexology is a holistic treatment that works on the feet and or the hands to balance the whole body. It utilizes pressure point techniques in order to energize the pathways or reflex zones of the body. Each part of the foot corresponds to a part or area of the body. The anatomy and physiology of the human body can fit neatly into the shape of the feet. The points on the left foot correspond to the left side of the body, and those on the right to the right side. And of course, reflexology and foot massage are two distinct and separate disciplines. Foot massage targets soft tissue and constrictions of the foot and seeks mainly to provide temporary relief from discomfort and pain from a general perspective, with less precise methods used to target specific areas. In addition, the distinction between reflexology and massage has been clearly delineated by exemptions of massage laws in countries such as the USA. And so you can see the clinical definition gives a bit more, I guess, on the medical side of things. So this is a explanation or a definition that is given many times to people who work in conventional medicine, because believe it or not, even though medicine is becoming more and more integrated, there are still some skeptics out there. So it's nice to be able to speak their language, as it were. So let's talk a little bit about the holistic approach of reflexology. Holistic healing means treating the whole person, the body, the mind, and the spirit. This entails looking at both the physical and emotional state of the person and their lifestyle. The body is treated as an integrated whole in the understanding that when one system is out of order, every other system is affected. This is a very different approach from treating symptoms and parts of the body in isolation, which often results in the root cause of the problems remaining untreated. In these cases, the patient or client never really becomes well and often progresses to suffer yet more disorders, maybe as the result of medication taken for a long period of time. It should be noted that no drug is really safe and all have a negative effect on another body function. They also weaken the immune system, the body's natural defense. Even 50 years ago, most family doctors had little to offer to relieve sickness and suffering, and a bottle of cough mixture, some pain-reducing medication, and a good bedside manner were their main tools. Most people with minor illnesses eventually got better, even if they did take a little longer than the rapid effect of medications, such as antibiotics, that are available today. Many honest physicians will tell you that their patients would probably recover from most complaints in 7 days if they did nothing at all. Our bodies have a remarkable ability to heal themselves. In fact, the body likes to be well and does everything possible to reduce inflammation, rid itself of disease, and restore balance. Included in the healing process is the effect of thought patterns which affect physical illness, as well as psychological factors that may be contributing to the expression or exacerbation of disease. There is a huge difference between being just free of symptoms and achieving maximum health. True good health means functioning at an optimal level in body, mind, and spirit. The well individual is one who is happy, healthy, and whole, and who perceives his or her life as one with meaning and purpose. Let's talk a little bit about energy fields. Everything that is alive pulsates with energy, and all this energy contains information. While it is not surprising that practitioners of complementary medicine accept this concept quite readily, those outside the field may find it harder to come to terms with. Nevertheless, it is worth noting that some physicists acknowledge the existence of an electromagnetic field generated by the biological process of the body. The human body is surrounded by an energy field extended as far as our outstretched arms and along the full length of the body. This energy field acts not only as a communication center, but also as a highly sensitive perceptual system. We are constantly receiving and sending information with every life experience that takes place. In other words, the mind and the body act as one. We as human beings are aware of our heart beating frantically when we are frightened. We know that it is possible to faint at the sight of an unpleasant situation, so it cannot be too difficult to understand how mental abstractions such as loneliness or sadness can also have a real and disturbing effect on the body. When depression, fear, anxiety, emotional pain, anger, or jealousy form a major part of our emotions, they adversely affect our immune system, which becomes weakened, and then disease finds it easy to take hold. The holistic practitioner recognizes that negative emotions are stored as negative energy, which causes the body to become out of balance, leading to a state of chronic disease. Complementary treatments, such as reflexology in particular, restore this imbalance and encourage the healing power of the body. So in terms of the aims of reflexology is much more than just applying pressure to the right place in the right way. A practitioner needs common sense and good judgment. It is important to know what can and cannot be achieved and to be equipped to answer a client or patient's questions. There are some important do's and don'ts that we must always bear in mind. Always be realistic in what we hope to achieve and avoid offering a cure or attempting to diagnose medical conditions. Be realistic in your aims as a reflexology practitioner. If you are a reflexologist treating patients regularly, you will need to decide for yourself what your specific aims are and the relief that you expect to be able to achieve for an individual client. It is obvious that if you are treating a patient who has been confined to a wheelchair for many years, suffering from multiple sclerosis, and who perhaps has acute, frequent bladder infections, that the most you will be able to offer would be to improve the general circulation, maybe to reduce the number of bladder infections, and generally give them a feeling of well-being, which will improve to the overall quality of their life. There is no way a reflexologist, however talented, is going to be able to get the patient to ever walk again or make the MS vanish. Similarly, it will be very unlikely that a middle-aged patient with a long history of asthma who has since childhood has been treated with steroidal inhalers in order to maintain some quality of life could be restored to full health. Generally speaking, long-term sufferers from asthma have impairment of lung function and often have an enlarged heart, which will have been under strain for years in coping with a limited oxygen supply during acute attacks. You could expect to achieve, however, a reduction in the frequency of attacks and the attacks of lesser severity. On the other hand, if you were treating a young man who has strained his back while carrying out some physical work, you could anticipate achieving total relief for him. Take a realistic approach to the treatment of patients and understand that although reflexology is a wonderfully beneficial treatment for a host of physical conditions, it is not a panacea. Don't offer a cure. Professing to be able to cure anything is a bold statement, and you will see some practitioners out there who make claims about reflexology being a cure. We are not to do that. The aim of reflexology is to be able to relieve pain, improve bodily functions, and help the body to eliminate its waste more efficiently, particularly the liver. Curing really means restoring the body to a near perfect state permanently. There is no treatment anywhere in either the orthodox or the complementary medical fields which can offer this. Don't diagnose or prescribe. There is much confusion regarding diagnosis. Reflexology is not able to diagnose diseases within the body. However, what the practitioner can do is find that a certain part of the foot reveals sensitivity, and this in turn indicates that there is congestion, inflammation, and tension in the corresponding part of the body. Frequently, by treating the sensitive areas, the inflammations are relieved, tension removed, and great improvement is achieved in the functioning of the system that was under duress. When sensitivity is found in the foot, it is absolutely wrong to jump to conclusions as to what it indicates. You may, for example, pick up a great sensitivity in the heart reflex area. The position of the heart reflex, points within the foot, also link up to the muscles within the chest, such as the pectoral muscles, and also link up to the heart muscles itself. Chest muscles can easily become overstrained simply through heavy lifting, gardening, or even perhaps carrying a toddler on one side for too long. It would be completely unprofessional to jump to the conclusion that a patient now has a heart condition, and it would be totally wrong and unethical to make such suggestions. Always bear in mind that a reflexology practitioner should never diagnose these precise problems. Only physicians are able to diagnose, for only they have the access to X-ray machines, equipment for blood tests, and scanning devices, and so on. So now let's discuss contraindications and special considerations for reflexology treatment. If a client or patient has a sprained ankle, any broken bones in the feet or legs, or ulcerations of the legs, perhaps associated with diabetes or maybe venous insufficiency, any of these conditions, you should work on the hands rather than the feet. If there is fungal infections, such as athlete's foot, make sure it is securely covered with a large plaster before you start work. There are a few other special points that need to be considered. Steroids. You need to use your judgment, but be aware that long-term use of steroids thins the skin, making it very transparent and prone to bleeding. Active shingles. Do not treat, as it may trigger the infection along the nerve pathways. Wait for at least 2 weeks after the spots have gone. Pregnancy. Never treat if there is a history of miscarriage. Some practitioners treat during the latter stages, provided the client is well, but many err on the side of caution, preferring to wait until the baby has been safely delivered. Serious eye problems. Varicose veins. Do not work over varicose veins. In fact, if you see any varicose veins in the lower extremities, I think it is safer to work on the hands. Heavy medication. Because the treatment has a balancing effect, it may increase the side effects of the medication. Diabetes. Do not treat acute diabetes because the balancing effect may adversely affect the condition. Menstruation. Do not work on the uterus, as it will increase uterine flow. Treatment can be given on the point until menstruation begins. And then the presence of an IUD. Be careful when working the uterus so that you do not stimulate the area. And, of course, be cautious also when treating children during puberty. Treatment during puberty can be beneficial, but take extreme care when working on the endocrine system. And of course, you will have to use your judgment for most of this. Some things the client may not even be aware of. For example, if you have someone who is in the early stages of pregnancy and they've had a history of miscarriage, well, they may come to you for a treatment session and not even be aware that they are pregnant once again, especially in the early stages. So this is where when you do your client intake, when you do a client interview, the initial consultation, you will ask these types of questions, and hopefully you will get an honest answer, and be able to make a determination as to what things you need to avoid and what things you can safely go ahead and proceed with during your treatment session. Now let's discuss how reflexology actually works. Pressure point techniques have an effect on the energy pathways or reflex zones of the body. Each part of the foot corresponds to a part or area of the body. Our anatomy and physiology of the human body can fit neatly into the shape of the feet. The points on the left root correspond to the left side of the body, and those on the right to the right side. Energy may be deficient, stagnated, or in excess, and reflexology aims to create balance and harmony in the systems of the body. Where there is congestion or imbalance, these can be detected through changes in the feet or hands. Like so many other therapies, there are some vague scientific explanations as to how the treatment actually works, but little research has been carried out to date. Part of the scientific issue for those who are broad-minded enough is that we do not currently have the technology to prove these theories. Now let's take a look at some historical perspectives with respect to feet treatment. Treating the feet, like so many other therapies, is an ancient art dating back some 2,500 years ago. Egyptian hieroglyphics and papyrus show hand and foot treatments. The Chinese have used pressure point techniques for even longer, even though these were incorporated in full body treatments such as acupuncture and shiatsu. Even the Cherokee Indians have passed down treatment techniques for healing using the feet. Reflexology as a treatment in its own right is still relatively new. Its development into the treatment we know today began at the turn of the 20th century when Dr. William Fitzgerald, an American ear, nose, and throat specialist, developed zone therapy. He discovered that applying pressure to certain parts of the body, in particularly the hands and feet, could give pain relief. He divided the body into 10 zones. Each zone linked organs and the energy flow between the zones. Fitzgerald further refined his findings before a colleague, Dr. Riley, and Riley's wife added the 3 transverse zones. Eunice Ingham, a physiotherapist, joined the Rileys and moved away from zone theory to develop a foot map pinpointing the body's organs and systems of the feet. This is the basis of reflexology as we know it today. Doreen Bailey, a student of Ingham, brought the theories to England in the 1960s. There are now several variations of the foot map produced by different schools of training. This only goes to demonstrate that our feet, like each of us, are individual. Let's discuss the benefits and effects of reflexology. Reflexology has a holistic approach in that it balances energy in order to return the body to a state of equilibrium on a mental and emotional as well as a physical level. The lymph system is boosted, improving immunity and the removal of toxins and impurities from the tissues. The treatment encourages the body to eliminate toxins and impurities, and this can be seen by an increase in the activity of the kidneys and digestive system. It is deeply relaxing, relieving mental and physical fatigue. In a deeply relaxed state, the body initiates its own healing forces. Reflexology doesn't heal, the body does. And reflexology has far-reaching effects, more so than working on the external area of the body. Further benefits include the treatment. It creates a feeling of well-being as endorphins are released. It eases pain as the pressure on the points act to confuse the body pain receptors and interrupt the pain cycle. It both stimulates and soothes the nervous system. There is a balancing effect on the endocrine system. Reflexology has been shown to affect blood pressure, having a normalizing effect. Although the benefits are often felt after a single session, regular treatment will maintain these effects. So when we talk about reflexology, it is important to discuss the signs of imbalance. There are several different changes that can be detected in the feet. Some of these can be experienced by the client while you work. Others may only be detected by your skill and touch. Sensitivity varies enormously from one person to the next. It is subjective and is not always a sign of something medically wrong. For example, a client who has had a rich meal and several drinks the night before a treatment is quite likely to show changes in the digestive organs, especially the liver. Now let's discuss some of the sensations that may be experienced during treatment. Pressure. For much of the treatment, the only sensation will be that of pressure. However, a client may experience increased sensitivity when working over a specific point or area. Sensitivity. When working a specific point, sensitivity may be experienced in the following ways: as if the skin is sore or tender, the area feels bruised, the area feels sharp as if a nail, splinter, or a sharp object is pushing into the skin. Crystals. The area may feel gritty and distinct crystals may be felt under the skin's surface. The client may also be aware of these crystals as you work over the point. There are debatable theories as to the nature of these crystals. One is that they are caused by a buildup of calcium deposits, which it is believed collect at the nerve endings in the feet. And the other is that the crystals are formed from uric acid, which collects at the peripheral capillaries in the feet. It may even be a combination of these things. Both theories agree that crystals are the result of faulty cellular metabolism and are a form of toxic waste. That they occur as a result of gravity working against the natural return of the peripheral circulation, making it sluggish. They may also be affected by the constraint from shoes. This is why it's important to educate our clients about footwear. And they can be dispersed by massage and removed by circulation. Traveling sensations. These may be experienced as tingling or sharp shooting sensations that travel around the body. They are experienced as the energy pathways are cleared, allowing energy to travel along a meridian line. Sensations in the body. Sensitivity may also be experienced in another area of the body. This may correspond to the point being worked or to a cross reflex. This is not uncommon where there is injury or internal scar tissue. Other sensations. Other common sensations experienced during treatment are a feeling of lightheadedness, a general tingling feeling, twitching legs, and a rumbling tummy. These are all very common. Now let's discuss the zone system. The feet can be divided into a longitudinal and transverse map. There are 5 longitudinal zones running vertically on each side of the body, either side of a central line. The zones begin in the head and end in the feet. These lines run all the way through so the body can be divided neatly into sections. There are 3 transverse zones that divide the body longitudinally. The transverse and longitudinal zones provide a grid-like map. These grids help to map the position of various reflex areas. By locating the organ in the body grid, you can map its expected location of the feet. Now let's discuss cross reflexes and related areas. A cross reflex is the crossover between the opposite area within the zone framework. This connection is used to link the energy flow from the upper and lower body. If one area or organ is out of balance, the whole zone may be affected. Cross reflexes are useful as they can be worked when you are unable to work a specific point. Sometimes the point may be very painful. There may be a contraindication to the point, such as the presence of verrucae, or it may not be advisable to work a specific point as it may aggravate a condition, as when there is inflammation. Note that an imbalance may also be sensitive on the cross reflex rather than on the specific point. And here we have the referral areas. The toes can treat the fingers. The feet treat the hands. The ankle treats the wrist. The calf treats the forearm. The knee treats the elbow. The thighs treats the upper arm. And the hip treats the shoulder. Let's take a moment here to appreciate the miracle of the feet. Each part of the body and every bodily function have their own relative reflex point in the foot. This allows an accurate picture of a patient's health to be given by the feet. If an area of the body is suffering from inflammation, tension, or congestion, the corresponding reflex points in the feet will be sensitive when pressure is applied. The feet are miraculous masterpieces of design, exquisitely put together and perfectly coordinating many components. Among the different components of the feet are tissue, 26 bones, 100 ligaments, 20 muscles, and an intricate network of nerves and blood vessels. These marvelous structures reflect comprehensively our state of health. The condition of our feet can give us much information about our physical and mental health. Likewise, how we treat our feet influences not only the performance of the feet themselves, but the functioning of our whole body and mind. It is a two-way street, a reciprocal relationship. Now, in terms of the maps and charts that we use for reflexology with respect to the feet, the hand, and the ear, you will see that there are slight variations in terms of where things are located, but for the most part, there is a standard uniformity that you will begin to notice as you journey along this path of becoming a reflexology practitioner. And so we're just going to take a look at the charts that are most frequently used or agreed upon in the next few slides. Here we have the zone therapy chart illustration, and it's pretty much agreed upon in terms of how the zones are located on the feet. And as you can see on the big toe has all the zones represented. And of course, the chart that we see here shows the transverse locations of the various reflex points, with the pink area conducive with the reflex points that are located in the head, the yellow for the reflex points that are located in the chest, the green, the abdominal organs, and then the pelvic area is represented in the purple on the heel. And here we have the foot reflexology chart. And of course, as I mentioned, you may see slight variations when you start to look at other sources in different books. But for the most part, this is standard in terms of where the various reflex points are located. This is a reflexology hand chart. And of course, this is the Reflexology Ear Chart. And this one is, just as the hand chart is similar to the one that is in your Reflexology Quick Reference Guide. So as I mentioned, you will see variations in terms of where things are located, maybe either slightly more to the right or slightly more to the left, or maybe a bit more superiorly or anteriorly, or inferiorly, I should say. But for the most part, there is I would say a pretty standard agreed upon location in terms of the reflexology charts. And once you become a skilled practitioner, you will not even need to refer to these charts, but certainly in the beginning stages, you will study these charts so that you will know what it is that you are working on. So let's just take a quick moment to talk about reflexology learning aids that are out there. And you by now will have seen that you received a reflexology pair of socks. They're also referred to as reflexology acupressure socks in your clinical instruments packet that you got last week. And so the acupressure socks, reflexology acupressure socks, are a great learning tool that can help the reflexology student to learn where the reflex points are rather quickly, because they illustrate the points on the socks. So these socks can be used in practice sessions as well as in a regular treatment session. So once you're fully qualified and you start to offer this service, you can purchase additional socks and have your clients purchase them as well, and you can make that a part of your treatment session. Or if you just want to have it as something that you sell in addition to some of your other healing products, these are great momentums, if you will, to have in your clinic. But for right now, they're very good in terms of helping you to know where the points are on the foot. And there are also reflexology gloves out there, for the hand. So really, there are quite a bit of resources and references that you can use as you learn how to apply this wonderful therapy. So let's talk a little bit about the reflexology education and training requirements. The Bermuda Natural Health Practitioners Council registers reflexology practitioners who have graduated from accredited institutions who have adopted the National Council for Reflexology Educators curriculum, and it was last updated in 2021. As of 2021, The NCRE recognizes that out of the 120-hour baseline curriculum, a minimum of 36 hours must be in class and in person. The remaining 84 hours can be in person and/or online. The core subject, of course, is reflexology theory and practice for a total of 55 hours, anatomy and physiology for a total of 30 hours, pathology and assessment for a total of 20 hours, and business management and practice development for a minimum of 15 hours. The College of Natural Health Sciences Bermuda is pleased to be the only local educational institution that offers training that meets and/or exceeds the NCRE's curriculum requirements. Okay, so we've reached the end of lecture number 5. And for your assignment for lecture number 5, I'd like for you to provide a practical and clinical definition for reflexology. State how does reflexology differ from foot massage. Describe how reflexology works and what claims should a reflexology practitioner be careful not to make. What is zone therapy and who discovered it? And what are the contraindications of providing reflexology treatment, and name some special considerations that must be considered before proceeding with a session. And as always, your assignment is due no later than this coming Sunday at 11:55 p.m. If you have any difficulty with the assignment, please shoot me an email or send me a text message. And my office hours are always from 4 to 6 p.m. on Thursdays. And with that, I will see you in the next lecture.